Have you ever got your blood pressure checked and saw the numbers 120 by 80, 130 by 90 and ever wondered what these actually are? Today, in this video, we are going to break it down into the systolic pressure, the diastolic pressure, and what do these numbers actually mean. BP or blood pressure is the force exerted by the blood in your blood vessels, which can be your arteries or your veins. Now, depending on whether the blood is being taken out of the heart or the blood is coming into the heart, that determines whether the blood is going through the arteries or through the veins. So now let's see how does it actually work inside the heart. So when the blood enters your heart, it goes to the lower chamber called the ventricles. And the ventricles of our heart are the ones that actually pump the blood. So when the ventricles squeeze, the blood will go out of the heart through the arteries into your body. This pressure exerted by the blood into your arteries is called the systolic pressure, and it is much higher compared to the diastolic pressure. Now, what is the diastolic pressure? When the blood goes into your body, it distributes oxygen to all the cells of the body and in turn takes out the carbon dioxide from the body. This carbon dioxide carrying blood is carried by the veins back into the heart. Now, since it is going a round trip, so while coming back into the heart, the pressure exerted on the walls of the veins will be reduced, and that pressure is called the diastolic pressure. Now, what about the numbers? 120 by 80, I think all of you have heard, is a normal blood pressure. Now, 120 is actually 120 millimeters of mercury that is measured into the measuring device. So when the blood pressure is checked, you will see a liquid goes inside into the tube and then comes down. So if it touches 120, that means your systolic pressure is 120 mm of Hg. And while measuring the diastolic pressure, if it stops on 80, then it means that your diastolic pressure is 80 mm of Hg. Hg here means mercury. Now, what happens if you don't maintain a proper blood pressure? You can have two serious situations. One is high blood pressure, or called the hypertension, or a low blood pressure called the hypotension. Hypertension or high blood pressure can cause a variety of health risks, for example, heart attack, strokes, or even kidney damage. This can be caused by a variety of factors like excess stress, excess amount of salt consumption, or even high cholesterol in your blood, because when cholesterol gets settled into your blood vessel, it creates a thick layer which reduces the amount of space through which the blood can flow, and as a result, it will create extra pressure on the blood vessels to allow more of the fluid to flow through the blood vessel. This extra pressure may ultimately lead to leakage or breakage of the blood vessel, that is your arteries, which is also called the myocardial infarction and can cause heart attack. So it is very essential for us to maintain our cholesterol level in order to avoid high blood pressure. During a low blood pressure situation, you can have nausea, fatigue, dizziness, and other factors, and even a shock can be life-threatening. But the good news is we can control the blood pressure fluctuations. But what do we have to do is to maintain a good diet, follow a proper exercise regime, and take less stress. I know it's hard to maintain your stress, but you need to manage your stress if you want to go away from having a fluctuated blood pressure. Your blood pressure is one of the best indicators of your heart health. So always remember to check your blood pressures regularly so that you can know what your heart is going through. So if you have someone in your life whom you think needs to listen to this, then make sure you share it with that person and ask them to share it to someone else whom they feel they need to hear it as well. Subscribe to Young Birds Academy if you want to develop a holistic knowledge about the different aspects of life.